We, from the Children's Oncology Group, looked back at the last two large osteosarcoma trials that enrolled COG patients. And after starting off with close to 2,000 patients, we reviewed slightly over 1,500 patients who were enrolled in these two trials. And out of those, we found that 3.6% of them had early local progression. What that means is their tumor grew while they were receiving induction chemotherapy before the actual surgery. Previously, that in such a large group had not been reported in the past, so we felt that this was important to share. We also found that the vast majority of those patients, all but one really, did not have good histologic response to the chemotherapy. And then the clincher was that the overall survival of those patients, as we would expect, was not as good as the patients who did not have early local progression. But more importantly, when we compared the early local progressors to the patients who had good histologic response from the chemotherapy, and also to the ones who had poor histologic response to chemotherapy, the early local progressors were the worst actors. So if you looked at as good response as the reference, as the baseline, poor responders were 2.5 times more likely to die from the diagnosis, and early local progressors was 6 times more likely to die from their osteosarcoma. So definitely worse outcomes.